Today, we explore a shocking medical mystery. Why do incredibly fit individuals suddenly suffer massive heart attacks? You eat perfectly clean, run marathons regularly, and look fantastic. Yet, a hidden danger might be quietly brewing inside your arteries today. Standard checkups often tell you everything is fine. However, these basic blood tests miss critical details that could ultimately save your life. Many patients leave clinics feeling completely invincible. They boast normal cholesterol, but a deadly storm is gathering deep within their very bloodstream. To understand this terrifying paradox, we must look far beyond basic lipid panels. We must examine our microscopic cardiovascular system very closely. Consider the story of a dedicated athlete. He exercises daily, avoids processed junk food, and maintains an absolutely perfect body mass index. His friends admire his immense dedication to fitness. His yearly physical examinations always return with seemingly flawless and highly encouraging medical results. His physician confidently shakes his hand, declaring him a shining picture of health. He walks away feeling completely protected from cardiovascular disease. Then, tragedy strikes without any warning. While jogging his usual morning route, he collapses suddenly from a massive, completely unexpected cardiac event. How does this happen to someone so healthy? The answer lies within the dangerous limitations of our standard modern medical testing protocols. Our traditional medical system relies heavily on basic cholesterol panels. These outdated tests only reveal a tiny fraction of the whole truth. The first hidden villain is chronic, silent inflammation. Even with perfect cholesterol numbers, high inflammation dramatically increases your overall cardiovascular disease risks. Imagine your healthy blood vessels as smooth, pristine pipes. Inflammation acts exactly like coarse sandpaper, constantly scratching their delicate inner biological linings. When these delicate vessel walls become damaged, your body rushes to repair them. This ongoing repair process ironically leads to dangerous blockages. Cholesterol particles get trapped within these microscopic scratches. Over time, they slowly accumulate, forming hard plaques that eventually block vital blood flow. Standard blood tests rarely check for this silent fire. Doctors usually focus entirely on lowering cholesterol while completely ignoring the underlying inflammation. You must specifically ask your doctor for a high-sensitivity C-reactive protein test. It accurately measures your systemic internal inflammatory levels. Knowing your precise inflammation level is the first crucial step. It empowers you to make targeted lifestyle changes to cool internal fires. Let us discuss the complex topic of cholesterol now. You know about bad types, but standard LDL measurements are fundamentally flawed today. Standard lipid panels only measure the total weight of cholesterol inside your blood. They completely ignore the actual number of dangerous particles. Imagine a busy highway completely filled with moving vehicles. Standard tests just weigh all cars together, never revealing how many actually crash. Having a low total weight means absolutely nothing if you have millions of tiny, highly destructive particles crashing into your artery walls. This is exactly where apolipoprotein B comes into play. It is a highly accurate marker because it directly counts every dangerous particle. Every single plaque-causing particle carries exactly one ApoB molecule. By counting them, doctors can precisely determine your true arterial blockage risks. You might have perfectly normal cholesterol weight, but massively high particle counts. This hidden discrepancy explains why many healthy runners suffer strokes. Small, dense particles easily penetrate your arterial walls. They get stuck much faster than larger, buoyant particles, rapidly accelerating deadly plaque formation. Therefore, requesting an advanced ApoB test provides a much clearer picture of your health. It leaves no room for dangerous guessing games. By tracking your ApoB numbers, you gain total control over your cardiovascular destiny. You can finally see the true microscopic biological threats. Now we must uncover an even more insidious threat. It is a terrifying genetic ghost haunting 20% of our global population. This extremely hidden danger is medically known as lipoprotein a. It is a highly sticky particle that rapidly accelerates arterial disease. Unlike regular bad cholesterol, you cannot fix this through strict diets or intense exercise. These specific levels are entirely determined by genetics. Many young, highly athletic individuals who suffer unexpected heart attacks have elevated levels here. It acts exactly like a silent genetic time bomb. This unique particle promotes both aggressive plaque buildup and dangerous blood clotting simultaneously. It is a truly lethal combination for your heart. Because it is purely genetic, you only need to test for it once. Knowing your baseline status is incredibly vital for survival. If your genetic levels are dangerously high, doctors can aggressively manage your other risks to compensate. Knowledge becomes your ultimate defensive shield. You can lower your inflammation, optimize your blood pressure, and reduce your ApoB. This comprehensive strategy effectively neutralizes the genetic risk factors. Yet there is one more massive piece to this complex puzzle. It is the underlying root cause of severe cardiovascular cholesterol dysfunction. We are talking about dangerous, silent insulin resistance. This condition quietly ravages metabolic health years before any official type 2 diabetes diagnosis. When your cells stop responding to insulin, your pancreas pumps out massive amounts. This chronic excess insulin severely damages your delicate arteries. High insulin levels directly promote systemic inflammation throughout your body. It creates the perfect biochemical environment for sudden, catastrophic heart attacks today. Insulin resistance also drastically alters your lipid profile. It drives up your dangerous ApoB particles while simultaneously lowering your protective good cholesterol. Standard fasting blood sugar tests will appear completely normal during these early stages. Doctors might mistakenly congratulate you on your perfect health. However, beneath those perfectly normal sugar readings, a raging hyperinsulinemia storm is slowly destroying your vital cardiovascular system from the inside out. Your pancreas is working overtime to keep your blood sugar stable. Eventually, it will completely burn out, leading to full-blown diabetes. To detect this hidden metabolic monster, you must request a fasting insulin test. This simple procedure reveals your true internal metabolic state. By catching insulin resistance early, you can completely reverse it. You do not have to accept a grim future of chronic medications. Fortunately, unlike stubborn genetic factors, insulin resistance is highly reversible. Strategic lifestyle interventions can completely restore your youthful metabolic flexibility very quickly. Intermittent fasting gives your overworked pancreas a much-needed break. It allows your insulin levels to drop, healing your damaged cellular receptors. Proper nutrition focused on whole foods eliminates the constant sugar spikes. Removing processed carbohydrates drastically reduces the heavy burden on your metabolism. Targeted strength training builds highly metabolically active muscle tissue. Muscles act like giant sponges, eagerly soaking up excess glucose from your bloodstream. Combining these powerful lifestyle changes creates an unstoppable healing force. Your inflammation drops, your particles improve, and your blood vessels finally heal. So, what exactly should you do during your next medical checkup? Do not blindly accept standard, outdated basic lipid panel results anymore. Take complete charge of your health by specifically requesting these 4 advanced diagnostic tests. You must actively advocate for your own survival. First, directly ask your physician for the high-sensitivity C-reactive protein marker. This will accurately reveal your hidden systemic internal inflammation. Second, firmly demand an apolipoprotein B test. This ensures your doctor accurately counts your dangerous particles instead of just weighing your cholesterol. Third, ask them to check your genetic lipoprotein a levels just once. This simple step uncovers any hidden inherited cardiovascular curses. Finally, always insist on a fasting insulin test alongside routine blood sugar checks. These specific numbers hold the true secrets to longevity. Armed with this comprehensive medical data, you and your doctor can build a genuinely effective prevention strategy. You stop flying completely blind. You can precisely target your unique vulnerabilities. Whether it is reducing inflammation or reversing insulin resistance, you will have a clear roadmap. Modern medicine possesses incredible tools to prevent heart disease entirely. However, these life-saving tools are utterly useless if never properly utilized. You must become the dedicated CEO of your own biological health. Nobody else cares about your vital heart as much as you. Educate your family about these hidden risk factors today. Sharing this vital medical knowledge could literally save the lives of loved ones. Remember, true cardiovascular health is not merely about looking fit outside. It is about understanding complex microscopic environments within your blood vessels. A visibly shredded athlete can still harbor deadly arterial plaques. True wellness requires deep, comprehensive biological testing, not just superficial mirror reflections. Do not become another tragic, unexplained statistical anomaly in medical journals. Be proactive, demand better testing, and protect your incredibly precious heart. Start making those crucial dietary adjustments today. Lower your intake of highly processed seed oils and drastically reduce refined sugar consumption immediately. Prioritize high-quality sleep to naturally lower your systemic stress hormones. Chronic sleep deprivation heavily contributes to both inflammation and insulin resistance. Manage your daily psychological stress through meditation or deep breathing exercises. Mental stress physically manifests as dangerous inflammation within your cardiovascular system. Embrace a comprehensive approach to your ultimate biological well-being. Every positive choice you make strengthens your resilient, life-sustaining arterial walls. We hope this deep dive into cardiovascular health empowers you greatly. You now possess the knowledge to truly understand your hidden risks. Never settle for incomplete answers regarding your precious, irreplaceable human life. Always dig deeper and demand the highest standard of preventative care. Your heart beats tirelessly for you every single second of every day. It is your ultimate duty to protect it with absolute vigilance. Please share this crucial video with anyone who prioritizes their health. Together, we can entirely prevent thousands of unnecessary, tragic heart attacks. Thank you for joining us on this fascinating medical journey today. Stay incredibly healthy, stay highly curious, and always keep learning continuously. This concludes our vital health presentation from Video Creator Today. Subscribe to our channel for more life-saving scientific insights and tips.